So it is important for us to get your views on the planned amendment.
The Uganda Medical Association was invited to give input in the Public Health Amendment Bill. The objective is to amend the Public Health Act passed in 1935 to change the obsolete provisions in the law. Whereas the doctor's body supports Clause 8, Section 53 of the bill, they are against any form of imprisonment for a person who refuses to be vaccinated. The bill spells out a 12-month prison sentence or a fine of 4 million shillings.
We really advocate for vaccination. What we, however, do not feel is right is to force people to vaccinate.
So I think rather than think that these people, you just have to force them, you just have to beat them, you just have to imprison them, it's not in good faith.
Imprisonment does not help. Community service is more compassionate and results in a longer term for behavior change, together with health education, and this will empower people to seek better health rather than put them in prison.
Another clause in contention was the ban on spitting and coughing while using public transport, with the doctors advocating for provision of receptacles for passengers.
But if someone is sick, maybe they have malaria and they are vomiting, so they should stay and die from home, they shouldn't even be transported to hospital. So it was ambiguous.
We can only stop them from spitting anywhere. So we then have to provide the relevant receptacles as in a public health environment, like they do in the planes.
The Uganda Medical Association called for a review of a proposal on the issuance of a court order to ban contaminated beddings and clothes of infected persons with highly infectious diseases like Ebola and Marburg.
So on the buildings, I think we can leave it, that the court should really have a say on this. But beddings and clothing, these are very small things.
Meanwhile, the Secretary General of the Uganda Medical Association, Dr Herbert Luswata, brought to the attention of the MPs unscrupulous doctors who issue medical certificates for driving permit applicants. According to Luswata, unqualified drivers increase the probability of accidents.
So when you are there, they give you a form which you are supposed to fill for medical fitness. You're supposed to check your eyes, what and all that. So someone told me that you want a medical examination. I said, yeah, we have someone who does for everyone. And indeed, we are doing for everyone. So they took me to a Kafunda somewhere, and they just brought out a form which is already signed by a certain doctor. And they issued it to me with a stamp. I took it and I got my driving permit, but no one checked.
The Uganda Medical Association has highly recommended that private medical practitioners should be involved in the management of epidemics after the original act locked them out. Ali Mivule, NTV.